More veterans can now take advantage of private health care after a recent program sparked thousands of complaints. It was a problem we brought to light in a 10 on Your Side investigation in early December. Chris Horne has been following this issue and made sure Senator Mark Warner was aware. The program designed to increase access to health care was actually shutting many veterans out, Chris?
Yeah, Anita, that's how it was working. Of course, it wasn't intended to do that, but the Choice program began in November to enable qualifying vets to use private providers, their own doctors. One way to qualify if you lived at least 40 miles from the nearest VA facility. Well, that's when veterans and their families discovered that the VA measured the mileage on a straight line rather than actual driving miles. Gabrielle Hanks was hoping to get private care for her husband, John. He's a Marine and Army veteran. They live in Moon, near Gloucester. Well, initially, they were told they did not qualify for Choice because on a straight line, it's less than 40 miles from their home to the Hampton VA. Hanks called the policy ridiculous and unrealistic because when they drove it, it was more than 50 miles around the water. Well, when Senator Warner heard about their plight, he contacted Veterans Affairs.
The notion if you live on the Northern Neck or the Middle Peninsula trying to get down to Hampton, 40 miles by the crow flies could end up being 60 or 100 miles driving. So I'm glad to see that the VA has finally taken action.
And under the new policy, the department will use commercial mapping apps such as Google to get a more realistic measurement on that mileage. A spokesman for the Hampton VA Medical Center says the hospital will begin to notify the veterans who are now newly eligible for private care under Choice now that the measurement policy has changed. On the national level, it's estimated the number of vets who will qualify now will just about double. Chris Horne, 10 on Your Side.